Hi, welcome to part 2 of our online lecture of the Maryland IEP document. And we're going to pick up where we left off by discussing about instructional and testing accommodations. This is slide 7 of your PowerPoint presentation, and instructional and testing accommodations begin on page 10 of your IEP in the PDF version, which looks like this. So before we actually get into the content of the IEP, it's important for us to talk a little bit about accommodations and modifications. So the question is there a difference between accommodations and modifications? So your choices here are no. There is no real difference between these two terms. Both are ways of describing strategies provided to students. Or yes, there is a difference in these terms. So think about it, see what you think, and let's see. So in fact, yes, there is a difference in these terms. Accommodations provide equal access to students, while modifications change the expectations of the assignment. Accommodations are practices and procedures that provide a student with a disability with equitable access to content. Now, incidentally, we also may have students who do not qualify for special education services and may, for example, qualify under Section 504, and those students may receive accommodations. We also may provide accommodations to students with students who are English language learners. And all of this is outlined in the Maryland Accommodations Manual, which you will review as a part of the course and should certainly review when you are a classroom teacher. If you're providing accommodations during assessment, you must be providing these accommodations during instruction. And the IEP, you'll notice, is specific to indicate on this right-hand side of the screen, or right-hand side of the page, what the conditions for use in instruction and assessment are. So as a general rule of thumb, it is not appropriate to provide an assessment to a student or to provide an accommodation on an assessment to a student if you're not providing that accommodation during typical instruction. However, there you'll notice on the IEP that if you're allowed to provide the accommodation during instruction, you'll see an I, and for assessment, you'll see an A. So you'll notice a couple, for example, are not eligible for provision during a standardized assessment, and you'll see that on the IEP. Accommodations are intended to reduce or eliminate the effect of the student's disability, but they do not lower the expectations. So there are 4 different types of accommodations that can be provided to students. The first type is a presentation accommodation. So presentation accommodations are ones that allow students to access information in ways that do not require them to visually read standard print. These alternate modes of access may be auditory, multisensory, tactile, or visual. So it is about altering the way in which the information is presented to students. And on page 10 of the IEP, you will see here, this entire page is devoted to the different types of presentation accommodations that are available to students in the state of Maryland. It's important, for example, if you select screen reading software, or text-to-speech software, or notes and outlines, that you then refer to the accommodations manual, which will define what that means, how that accommodation should be provided, what the best practices are for that. Another type of accommodation that may be provided to students is a response accommodation. These types of accommodations allow the student to complete activities, assignments, or assessments in different ways, or to solve or organize problems using some type of assistive device or organizer. So it alters the way that students will complete the task. So let's take a look at the IEP document, and we find response accommodations on page 11. So students may have a scribe someone who is writing their answers for them. Students may respond on the test booklet. Students may use a graphic organizer. Okay, students may use another specific sort of writing tool or writing implement. So these are all examples of response accommodations. Now, incidentally, notice that you will see on every section of the accommodations, you will see this field that allows you to document basis for decision. So if you select, for example, on page 10, if you add a presentation accommodation to the student's IEP, which in the online system will look like a checkbox, you will check off the accommodation that you're choosing. Then you're going to come down here to discuss or document basis for decision. And this is a required field. So every time I select a presentation accommodation, I must fill out the box below. Every time I select a response accommodation, I must fill out that box below. And in this box, I'm going to provide additional information that is going to discuss how the accommodation is going to be provided to the student and why the team determined that this accommodation is appropriate. An incredibly important part of learning to develop an IEP is making sure that the selections you make are directly based on the needs of a student. So in this IEP, in this section of the IEP, I must indicate the needs of the student that required my choice. So if the student has a scribe, why do they have a scribe? What need is outlined on the present level section of the IEP that requires me to make that choice here? Every accommodation selected must be based directly on the needs of your student, and the connection between the need and the accommodation should clearly appear within this document basis for decision. Two more sections of accommodations that are available are timing and scheduling. In timing and scheduling, we can increase or adjust the amount of time a student is allowed or change the schedule of when the activity or the assessment will be completed. In setting accommodations, we may alter the location where the assignment or the test will be completed. So let's take a look at some of the examples that we have for timing and scheduling. We may allow a student to have extended time. Now, a best practice for extended time, if I select extended time and then I come down here and I'm ready to document my basis for decision, I may discuss why the student needs extended time. Perhaps the student has attentional needs that require extended time. Perhaps the student needs extended time for processing that we've uncovered in some of our assessments. So I'm going to talk about that here. But then a great rule of thumb is to include the typical amount of time that the student needs. Extended time does not necessarily mean time and a half. It means what the student needs and what is appropriate to the task. And so these are all tips that you'll learn from reviewing the Maryland Accommodations Manual. But remember, that's a frequently used accommodation, and so be sure that you're putting those types of details under document basis for decision. And then setting accommodations, you may be removing the student to a different location or adjusting the location where they're sitting or participating in the activity in your classroom to either reduce distractions to them or to other students in the class. And so those are some different options that you have there. As we said, the accommodations must be selected based on the individual characteristics of the student. And so as you're working with groups of students, it's important to be sure that all of their accommodation sections may not look the same. And if you're creating IEPs that all look like one another, you're losing that individualized component of the document. The IEP must only include those accommodations which are necessary to provide the student with access to the general education curriculum. Modifications. What is the difference between a modification and an accommodation? Well, a modification is a practice or a procedure that changes, lowers, or reduces the learning expectations. Now, We need to have a word of caution about modifications because modifications have the potential to increase the gap between the achievement of our students with disabilities and our students without disabilities. Using modifications may result in implications that adversely affect our students. We need to be judicious about modifying assignments for students, but certainly if we need to make modifications based on the needs of our student in order for them to access the curriculum, then we do that. So there is no section of the IEP called modifications, but there is a big long title for this section on the IEP, and it begins on page 13. So let's take a look at that. So the place where you find most modifications on the IEP is in what we call the supplementary aids, services, program modifications, and supports section. And many times you will hear this just referred to as the supplementary aids section. So you'll notice that this portion of the IEP is broken down into sections, and you have many choices. So you have a drop-down menu of choices that's available to you when you're in the computer system. So you see here on page 13, these are your options for instructional support, although there is a box here for other. So if you have a student who needs an instructional support that's not listed here, you can add that. Page 14 talks about program modifications. More general types of things, breaking down assignments, chunking texts, limiting the amount of required reading, or modifying content. In some other types of methods for doing that are on page 14. Page 15 outlines modifications that a student may need in the area of social or behavioral supports. Do they need additional adult support or adult assistance in the classroom or in and around the school? Do they need crisis intervention? Is the student going to need a behavior contract or an agenda book or frequent breaks? So supports of this nature are provided on page 15. And then physical and environmental supports are listed on 16, followed by support for personnel and families are listed on page 17. And page 17 is a place where you may indicate specific trainings that need to occur, consultation that needs to occur between service providers or service providers and parents, perhaps some consultation that is unique. You could indicate that here as well. So you'll also notice in this section of the IEP that you have the option to indicate clarify location and manner. And that is where you're going to discuss where and why. Or where and how, excuse me. So you're going to talk about where the support is going to be provided and how the support is going to be provided. Because simply checking some of these items in the top left-hand box here might not be sufficient for you. So pretend as though you were receiving this IEP and did not know the student or weren't familiar with them. What kind of details would you need to be able to pick up this document and implement it exactly as your team wishes or determines that it really needs to be implemented? And then you also see, once you select the nature of the service, you are going to indicate how often the student's receiving the service, when it begins, when it ends, and who is the primary service provider. In many cases, you may list a primary service provider. For example, you may list that the general education teacher is the primary service provider who's going to allow the use of manipulatives, perhaps during math class. But another provider could certainly be the special education teacher, who can also provide that service. So you're going to indicate all of the folks who are going to be involved in that service. So some additional examples of modifications, even though we've just taken a look at a few on the IEP: requiring a student to learn less material, reducing assignments and assessments so that a student completes maybe the easiest items, or revising assignments or assessments to make them easier, for example, offering less choices on a multiple choice test, giving a student hints or clues to support their understanding of the information. And so you may make these modifications during classroom activities or assignments. You may also encounter students who need homework modifications and things of that nature. And again, these are supports that you want to put in place for a student when they absolutely need them to be able to access the general education curriculum. So we talked about how this section of the IEP outlines those modifications, and the supplementary aid section is going to indicate how, when, who, and where, all the most basic information about how that information is going to be, how those supports and services are going to be delivered to the student. So moving on now, we're going to progress to the extended school year section of the IEP, and this begins on page 18 of your PDF document. IDEA requires that each public agency or school district must ensure that extended school year services are available as necessary to provide FAPE. ESY services must be considered for every student. Now, this does not mean that these services must be provided for every student, only that the need for ESY must be considered for each student who has an IEP. If required, the specific services, the starting date, the ending date, the site where the services will be provided, and the instructional delivery should be recorded on the services page of the IEP. And when we get to that portion of the IEP, we'll talk about that a bit more. The IEP team is charged with the decision of determining on a case-by-case basis if any of the factors listed in the IEP would significantly jeopardize the student's ability to receive some benefit during the regular school year. So the IEP team is going to discuss the student's eligibility for ESY. So if we take a look at the ESY section, which begins on page 18 of the IEP, it says at the top, the IEP team should determine if any of the factors will significantly jeopardize, which we just said, the student's ability to receive some benefit from their educational program during the regular school year if they do not receive services over the summer. The IEP team is required to discuss each question. So if we take a look at some of the questions, does the student's IEP include goals related to critical life skills? Is there a likely chance of regression of critical life skills caused by the normal school break? Is the student demonstrating a degree of progress toward the mastery of their IEP goals? Is there a presence of emerging skills? Are there interfering behaviors? Does the nature and severity of the disability warrant ESY, or are there special circumstances? So it's important to know that there is no exact formula related to responses to each of the questions, which ultimately leads the team to determine whether the child is eligible. But the team must determine on a case-by-case basis, by reviewing all of the responses to these questions, whether or not the child is eligible. And in determining that eligibility and having this discussion, the other thing that the team needs to look at is data. And so team members need to bring data that indicates whether or not the child, for example, exhibits regression over a school break, for example, over a holiday, or from last school year to this school year, over other types of extended breaks that may occur during the school year. And then that type of information can really support the team in asking those questions. And so again, the more information that team members can bring, the more judicious the team can be about making this decision for the student. If the team believes it is too early in a school year to adequately address a student's possible need for ESY, the IEP team may defer the decision to a later date, and you see this option at the top of page 18. The next section of the IEP is the transition section, and this section of the IEP is required for students who are turning 14 during the academic year and beyond. Typically, this section of the IEP may be completed by a person such as a transition facilitator or an individual who specializes in secondary and post-secondary outcomes for students, a related professional, or perhaps members of the IEP team collaborating together to complete this. And based on the area of certification for participants in this course, we will not be reviewing this section. However, it's important to know that this section should be tailored based on the vocational interests, needs, and aspirations of the student. And when children are young, prior to age 14, it's still important to emphasize self-determination, self-advocacy skills, and to gain some information about the student's strengths and their needs so that when the IEP team comes to the point of discussing transition, there's some cultivated information in that area. So the transition section of the IEP is rather lengthy. It starts on page 19 and it continues through 20, actually 19 and 20, before getting into page 21, which we'll talk about now, which is the goals section of the IEP. Now, beginning on page 21 of the IEP document are the section related to goals and objectives. Measurable annual goals with accompanying short-term objectives or benchmarks should align with the student's present levels of performance. So again, the goals must correspond to the information that you've entered within the PLAF section of the IEP. And then relevant objectives for each goal are created based on the individual needs of the student. So 2 important things for you to keep in mind, and I'm going to highlight these because I want to make sure that you star them and that you take some notes here about this information. So 2 important things. When you're selecting the goal or you're writing the goal, you're going to utilize the child's chronological grade level or the grade in which they're enrolled. So if you're working with a student who's enrolled in the 2nd grade, then you're going to write a goal at the 2nd grade level, or you're going to choose a 2nd grade standard in which to base that goal. And then when selecting or developing an objective, you're going to utilize the student's instructional level. So for example, to continue with my 2nd grade student, I'm going to write a goal which focuses on the 2nd grade standard, maybe for example, related to reading comprehension. But if I have a student who's working on or comprehending text at the kindergarten or maybe the 1st grade level, I may use the curriculum to back map, and I may write an objective that is scaffolded. It is at the kindergarten or the 1st grade level to allow him to eventually move and progress toward that 2nd grade standard. So the goals section, which starts on page 21, you'll see here's your area for developing your goal, and you're going to indicate when you expect the student to achieve this goal. Typically, this achievement date is based on the annual review, unless there's a reason why you expect the student would achieve the goal sooner. You're going to identify an evaluation method. How are you going to determine whether the child has met or is making progress toward the goal? What procedures are you going to use? And then what's the criteria for mastery? Is it going to be a percentage of accuracy? 60, 70, 80, 90% accuracy? Are you going to expect to see a decrease in the skill or the behavior? Sometimes that is used for behavior. 8 out of 10 trials, 5 out of 10 trials. Are you going to expect an increase or some other method for determining criteria? So again, your selections here really should be based on the skill itself. You're going to determine the evaluation method and your criteria for mastery. This is your criteria for mastery right here, this width, based on the skill. And so how you write a goal for reading might be slightly different than how you write a goal for math. Certainly going to be a little different than how you might write a goal for social skill or behavioral skill. And then the Maryland IEP allows you to add up to 4 instructional objectives which correspond to your student's IEP. So again, remember that this goal is based on the student's chronological grade. And then the objective is based on the student's instructional level. So keep that in mind when you're developing IEPs. Now, a bit more detail about how you'll write your goals and objectives are contained in your PowerPoint, although we will be going over this much more in depth in class. But we're going to talk about developing SMART goals. And SMART goals and objectives are those which are strategic and specific, measurable, attainable, meaning they are attainable within 1 year because that is the life of the IEP. They are results-based and they are time-bound. So as we progress through that process, it's important for you to keep in mind that the goals and objectives are really going to be what sets the instruction for this student slightly apart from those students who may not have an IEP. Now, we'll be discussing this more in class, but it's important that you know or make a note that every goal and objective must include 3 things. Every goal and objective must include 3 things, and I'll type that here for you now. Every goal and objective must include 1, a condition statement, and the condition statement provides the environmental conditions or tells what supports will be present for the student in order for them to accomplish the task. So it may say, given a grade level text, or given a modified text, given manipulatives, given an open-ended question. So it tells the reader something about the conditions or the supports that will be present. The second thing every goal and objective must include is the observable, measurable student behavior. In other words, exactly what the student will do. How will you know when the student has achieved this goal? And it's important that that behavior be observable and measurable to anyone who's observing the student. And so the clearer you can be about this, the better. And then the last, which is hard to forget because it is built in to the IEP document, is the criterion for mastery. And that you'll indicate right here with blank % accuracy, blank out of blank trials. And so those are the 3 things that you'll need to include: the condition statement, the observable, measurable student behavior, and the criterion for mastery. There's an area at the bottom of the page entitled Progress Toward the Goal, and you'll see that here. And this is the opportunity for the special educator or another service provider to indicate the student, the progress that the student is making toward the annual goals. And so there are 4 progress codes. You may mark achieved, making sufficient progress to meet the goal. You may select newly introduced skill, not measurable at this time. You may indicate that the student is not making progress, not making sufficient progress to meet the goal, or you may indicate that this skill has not yet been introduced. And then there's also an opportunity to enter a description of the progress that the student is making. So this progress report is completed at least quarterly, and the dates to indicate when the progress report is completed are here on the left. If the student's participating in ESY, there's also a progress report for that as well. The next section of the IEP that we're going to be discussing begins on page 22 and continues through page 24. And this is the special education services. The special education services outline the direct services that will be provided to the student. So this may indicate classroom instruction, for example, special education services. It may indicate related services such as speech and language therapy or occupational therapy, physical therapy. It may also indicate career and technology education services, if that is applicable to the child, and if the student has been determined eligible for extended school year, then those services will be outlined here as well. This section of the IEP includes quite a bit of information. It includes the service nature and the location where the service will occur, how many hours of service, minutes of service the child will receive, and who will provide that service. So if we take a look beginning at page 22 of the IEP, you'll see the various sections that this is broken down into. Special education services, which includes classroom instruction. And it's important to note that after, let's say for example, we're going to talk about classroom instruction. We're going to indicate whether the student is going to receive that instruction, and remember this is instruction that is somehow different, this is specialized instruction, somehow different than the instruction that's being provided to every student in the classroom. And we're going to indicate whether that is provided in general education or whether that is provided outside of general education, for example, in a special education classroom. We're going to indicate the number of sections, or number of sessions, that the student will participate each week, the number of hours and minutes, whether this is going to occur daily, weekly, monthly, or on some other schedule determined by the IEP team, the beginning date and the end date. Now typically the beginning date is the date of your meeting, typically the end date is the date of the annual review, but there's a variety of reasons why that might be different. For example, if the student is beginning at a new school at the beginning of the school year, so September or late August, the student's going to be beginning a new school, and in that circumstance they're going to need a different service, then you may see that the beginning and end dates here are different. And then just as in the supplementary aid section, you're going to indicate the primary service provider and any other secondary service providers who are also instrumental in providing that service to the student. And then this summary of services usually calculated for you to indicate the total number of hours and minutes that you've entered. If the student is eligible for extended school year service, there's also a line for you to indicate that as well. And then below you have this discussion of service delivery. And discussion of service delivery is important because it allows you to ensure that service providers and parents understand the unique nature of each service. And this is very helpful to clarify for the next set of service providers. And so, just as an example, let's say that you've selected classroom instruction in general education at the top of this page. And the IEP team has made that selection because this is a student who's going to need support every day in math. You may want to indicate in this discussion of service delivery at the bottom that the student needs this direct support in math. And so you may determine content-specific information, you may describe exactly what the service or the support will look like, anything that will make it clear to team members implementing the IEP. Following the special education services, you see a similar section where you are going to enter related services. And so things like psychological services, occupational therapy, physical therapy, counseling, all of these are contained under related service, and you'll continue to indicate the location, the service description, the providers, etc. Same thing, there is also a section for ESY. If the student is receiving related services in ESY, you may indicate that here. And incidentally, it's important to note that one of the reasons why ESY appears here as a separate line item is that it's possible that the student may receive a different amount of service, hours, minutes, etc., during ESY than they receive during the school year. For example, if the child receives 10 hours of classroom instruction during the school year, that doesn't necessarily mean that the student should receive or will be beneficial for the student to receive or necessary for the student to receive 10 hours of classroom instruction during ESY. The IEP team may choose to decrease the number of hours or the type of service that's going to be provided. So that's why you have a separate line item for extended school year. Following those on page 24, you also see an opportunity to enter career and technology education services. Typically, this section is used for older students who are working on their secondary and post-secondary outcomes. And so the last section of the IEP that we're going to focus on in depth is the least restrictive environment section, and this begins on page 25 of your PDF document. When making a placement decision, the IEP team must carefully consider the least restrictive environment, as this is an important component of IDEA. The placement decision determines where the student's special education instruction will occur, and this decision is made by the IEP team and based on the student's IEP. The student must be educated in the school that he or she would not attend, or that he or she would attend if not disabled, unless the IEP team indicates that another school is appropriate. The IEP team must consider placement closest to the student's home if the student is not in the school where they would attend if they did not have a disability. So beginning on page 25, this section of the IEP clarifies the relevant environments that the team considered, as well as the information to support the team's decision. In this section of the IEP, you will calculate the amount of time that the student will spend inside and outside of general education, and you will also include information related to student special transportation services if they require these, and access to non-disabled peers for non-academic activities. So let's take a look at this section. In short, the LRE relates to the settings where a student with a disability receives special education services and how much time is spent in those settings. So in this section, we're really talking about how much time and where the services will be provided, not what services they are to receive, because we've already talked at length previously in the IEP about what services they are to receive. Now it is time to talk about where and how much time is required to implement those services that we've outlined. It's important to remember that placement decisions cannot be based solely on the student's disability, either the category of the disability or the severity of the disability. They cannot be based solely on a student's language or communication needs, and they may not be based on modifications needed in the general education environment or the school district's delivery system or the availability of service or what is convenient for a district or a school. Placement decisions must be based on a student's needs. So the first question at the top of this section is, what placement options did the IEP team consider? And because of the least restrictive environment component in IDEA, the IEP team should consider the general education classroom first and or the homeschool first. And then if this environment is determined to not be appropriate for the student, or there cannot be reasonable accommodations or modifications provided to that in that environment, then the IEP team may begin discussing more restrictive options, but they should always begin with that discussion of the general ed environment first, followed by general education environment with supports, then perhaps a mixture of general education environment with some pull-out services, and on down the line toward that discussion of perhaps self-contained classroom with specialized staff such as a special educator, paraprofessionals, etc. If the student is removed from the natural environment with non-disabled peers and they are 3 to 5 years old from general education setting, the team needs to document why other restrictive options were considered, but why services may not be delivered in those settings. And so you see some special questions on this section for students who are 3 to 5 who are not participating. For example, you find that section right here. And then once the placement determination has been made, there is a place for the IEP team to document the basis for that decision, and then that will indicate the setting that the student will receive. So beginning here, here's your inside general education for 80% or more of the time. That's considered or called LRE A. Inside general education for 40 to 79% of the time is considered LREB. And inside general education for less than 40%, which typically looks like a self-contained classroom type model, means that a student is out with typical peers for less than 40% of the day. And then progressively, some of these more restrictive options, such as a public separate day school, which is a public school only attended by students with disabilities, as well as private schooling, residential facilities, and other settings where students may receive services such as home and hospital services, even correctional facilities, are listed here as least restrictive environments. The IEP team must consider whether or not there are any potential harmful effects on the student based on the placement that's been determined, and if yes, the team is required to document the basis for that decision. The IEP team is also going to answer questions such as, are the services in the student's home school? If not, is the placement as close as possible? And then, does the student have special transportation needs? Underneath of the least restrictive environment discussion is this question as to whether or not the student requires the related service of transportation based on their unique needs, or whether special transportation is needed to allow the student to access their special education services. And so here the IEP team is going to indicate yes or no, and then they're going to document the reason for eligibility. Is specialized equipment needed? If yes, then the team should document all the specialized equipment that the child needs. If it is determined that the student requires personnel to accommodate him or her during the transportation, then the type of role that the personnel is needed to perform for the student also needs to be included in this section. And if there are any other supports that the student needs during transportation, these should be indicated here. The IEP team must also consider whether the student will participate with non-disabled peers in academic, non-academic, or extracurricular activities. And the team must specify the extent to which a student will not participate if it's determined for any reason that they cannot. If it is the student's initial IEP, you will see the consent for initiation of services on page 26 of the IEP document, and this indicates a parent's consent, or this section allows for the parent to indicate consent for initiation of services. So let's take a look at that now. So again, if on the cover sheet the developer of the IEP indicates that yes, this is an initial IEP, this section will be available to have this additional signature location for parents. And remember that if a parent does not consent to initiation of services for the initial IEP, then services cannot be provided. Also on page 27, there is another form of authorization. If a student is eligible for medical assistance, then this is an opportunity for that to be documented on the IEP as well as some defining information about that section. So thank you for your attention in this last of our IEP lecture for the Maryland Online IEP. If you have questions, again, we hope that you'll take a few minutes to jot down some of your questions so that you can share them with your instructor during class. And again, good luck on the quiz.